Our first speaker is Umar Farouk from UK, who will give us a 1-minute presentation on MIS transthoracic extrapleural rib XLIF.
Giant thoracic discs pose a surgical challenge in access due to their central location and difficult cord manipulation due to thoracic kyphosis, narrow canal, and pre-existing myelopathy, making dorsal and dorsolateral approaches fall short of access and neurological outcome, whereas anterolateral approaches offer better but come with a hefty 35% pulmonary complication alone tag. We present a case of a 36-year-old female with progressive myelopathy for 6 months with a T7-8 central giant thoracic disc occupying more than 80% of the canal diameter. An MIS transthoracic retropleural rib-sparing XLIF was performed with a 3 centimeter incision, less than 50 mils blood loss, and patient was discharged at day 4 with good neurological outcome. We believe it's a good approach which avoids lung deflation, pleurectomy, rib resection, and chest drains, and attains good neurological outcome with a short incision and short post-op stay. Thank you very much.
Thank you very much for your presentation. That was fantastic. Again, more questions, please send them to the chat room or via the email, as these presentations are only 1 minute long. I'd like to introduce our next speaker, Maria Monica from Indonesia, who will talk about use of IOM in spinal tumor surgery. Maria, are you on? There she is.
Okay. Greetings, sir, ma'am. My name is Maria Monica. I'm a GP from Indonesia, and today I'm going to present to you my poster titled The Use of IOM in Spinal Tumor Surgery, a Systematic Review. The use of IOM may improve the likelihood of maximal spinal tumor resection with a minimal post-operative deficit. The purpose of this review was to evaluate the use of IOM in detecting post-operative neurological deficit in ST resection. So a literature search was conducted. Among 159 identified articles, 24 studies were selected. So high or more than 80% specificity was found in more than 45% of all studies, while high sensitivity was found in more than 40% of all studies. 10 studies also reported gross total resection in up to 96.3% of all their cases. So this review concludes that although not consistent, more than half of the studies reported IOM had high NPV, PPV, specificity, and sensitivity. Prospective randomized studies will be needed to further clarify this. Thank you.
Thank you very much for your presentation and congratulations. I'd like to introduce our third and last poster presenter, and I am apologizing ahead of time for mispronouncing your name, but Wararas Trethitham from Bangkok will present on preliminary outcomes of MIS surgery for spinal metastasis. Is our third speaker.
Okay, hi, I'm Walaya Trethitham. I'm proud to present the preliminary outcome of minimally invasive. You hear me? Can you hear me?
Yes, we can hear you great. We can hear you just fine.
Okay. This is the surgery in the spinal metastasis. It's an example of the scar from the operation. The demographic and data is from the retrospective. The operative time and blood loss were significantly lower in the MIS alone group, and visual analog score for back and leg pain reduced significantly in both groups. For my conclusion here,
we are unable to see your screen. Can I interrupt you for 1 second? We're not able to see your poster. Are you able to present your poster, share your screen?
Now do you see the screen?
We do not.
Yeah.
Yeah, here we go. Yes, go ahead.
Okay. So I will go to the outcome. Okay.
Okay.
So the outcome here, the operative time, the estimated blood loss was less in the MAS alone group when comparing with the MAS with decompression group. And the leg pain and back pain for visual analog scale was significantly reduced in both groups. And in conclusion here, the MAS is effective for reducing pain in spinal metastasis patients. Yeah, I'm finished here.
Thank you very much for your presentation.